Hey everybody, thanks for joining us in this workshop. Today we're going to cover children's oral care and how we can help further a healthy mouth for children. But first we're going to do raise of hands just to get everybody kind of loosened up with kind of a quick fun survey. Let's think about how much should parents pay. Sorry, the tooth fairy pay. For those who think that it's less than 25 cents, raise your hands. 25 to 75 cents. And then the bigger spenders, 75 cents up to $5. And then the really big spenders, over $5. All right. Well, we all know where everybody values a tooth for. So let's go into the presentation. If anybody had any questions or would like to contribute during this time, please feel free. So, brushing teeth twice a day keeps the bugs away. That's kind of the slogan that we've chosen because we want to encourage these children to get in the habit of brushing their teeth at least twice a day. And the reason why is because it's estimated that over half of children, just a little bit over half of children under the age of 11 have tooth decay. Which tooth decay, I didn't really think about it as this, but it is a disease, and it is a disease that is preventable. So this is one reason, a big reason as to why we've taken on this initiative, is because of the story that recently a Maryland boy has passed away due to a simple tooth dental cavity. Excuse me. The decay slowly turned into an infection or an abscessed tooth, which when it gets that, even if it's an infection, it can still have a root canal, but it was never treated, so that infection eventually reached his brain. It is a sobering thought that this could have been prevented with just an easy, estimated about $80 procedure. But that's one reason why we hope to push this initiative through and help everybody become more educated with oral care. But in this instance, let's focus on how we can help children. So, one role of the government is to protect the vulnerable, and some of the most vulnerable people are children. And it shows that those children that live in poverty have a higher risk, and also minorities. So let's get the discussion going. Why do you think this is the case? And then the next question is, how can you, as educators, help resolve this problem? Okay, and then we go into obviously we just want to focus on brushing twice a day, but there are certain methods that should be taught. Children need a soft bristle, so this isn't necessarily something that a child can control because they're not the ones going out and purchasing the toothbrush, but this is something that should go in a pamphlet or maybe a homework that goes to the parent that encourages them to buy a soft bristle brush. This can be taught to them. It needs to be in a circular motion and with light pressure. It is shown that electric toothbrushes are more effective, plus they usually have more artwork, and some children like that. But it is shown that those are more effective. But like anything with just a normal toothbrush, if used in the correct manner, with the circular motion and with the light pressure, then it'll be just as effective. So don't necessarily encourage kids to get an electric toothbrush because we don't want them to feel the burden of purchasing some of these children, like in the earlier slide. a lot of these children will be in poverty that you teach, and you know a lot of their background. So the biggest thing is get the soft bristle. If they do not, if they use a harder pressure, and make sure you touch on this, because if they're really working away at their gums, then it can actually do more damage brushing their teeth by eroding their gums and then exposing that root, which is not protected like the rest of the tooth. So do you think, let's have a quick discussion also. So do you think a standardized lesson plan should be created for you to follow? Right now, we don't have one, but we would be willing to create one. So what are your thoughts on this? And these are just some facts just to hit on, just as we kind of close. Just to remember, I know we touched on it earlier, but it is estimated that almost half of children from ages 2 to 11 will develop tooth decay in their primary teeth. So the primary teeth are the first ones that come in. So a lot of times parents or even kids will have rotten tooth, and it's thought that tooth will fall out eventually, so let's not worry about it, but they still need to keep brushing their teeth and make sure that they're eating good, healthy foods. I guess that's one thing that we need to touch on also, is not to have sugary foods. Those really are what fuel those sugar bugs. And it is recommended by the ADA that children should brush their teeth at least twice a day, both morning and night, and floss at least once a day. But that's good to focus on morning and night to make it a routine for those kids. So we invite you to cover at least 15 minutes twice a week about oral care in class.